comfortable as I ultimately became. And actually, so here's an example of a missed opportunity. So I felt I ought to go to the bathhouse before participating in this debate. So Frank goes to the bathhouse is another anecdote.
Frank goes to the bathhouse.
So as it happened, one of my patients was the director, and so I said, I've got to go see this. I'm not going to be in this debate without having been there. So I went with the clinic nurse, female, and with a male friend of mine, and the three of us went down there. We went to a gay porn show just before it to get a little sense of what gay sexual behavior was like. And then we marched over to the bathhouse. And the bathhouse was highly fortified. So they would be raided, you know. So the cops would be able to break down the door, but it would take them it would take them 5 or 10 minutes to break down the door. It was fortified. You go down a long corridor, and there's a big, heavy-duty glass thing at the other end of it, and heavy-duty doors, so they could see you coming from way off, and the doors, they were not easy to break through. Cops could do it, of course. So I go there, and my friend is there behind the door. He lets him in. And there's a PA system, and he announces, Dr. Frank Rhame from the university is here to inspect the bathhouse. You know, so today, what I would do is I'd grab the microphone and say, hi, my name is Frank Rhame, and I would like to talk about what it's like here at the bathhouse, and anybody who wants to talk to me, come to the meeting area, and let's just talk about whether it's a good idea to close the bathhouse down or not. But I didn't do that. So I walked.
So you inspected.
Yeah. Well, so they made the female nurse sit in the office. They wouldn't let her around. So she sat out the whole interaction in the office. They wouldn't let her pass the office. And my male friend and I walked around. Did not change clothes. Did not put on a towel. They were absolutely sure that the two of us wanted to have sex with each other, and kept offering us a roomette to do that. And we looked around. You know, it was important. First of all, it's huge. You know, so it has a bunch of meeting rooms downstairs, and a big communal area downstairs, and then upstairs there must have been 60 little tiny cubicles. You know, half the size of this. A mirror, a couch, a mirror, or just a flat bed and a mirror, and an entrance and chairs sit down to. So there were jars of condoms around, and I didn't ask, as I would today, how often do you use condoms?
Right.
The question I would have asked many times is, do you feel at risk from HIV? Because that, I think, is really the crucial thing. And I would say that most of those men would have said no, even though it was very much the opposite. And that, I think, would have been an important clue for me in the debate.